Cesarean section or normal delivery? One may ask, why cesarean section or normal delivery? The thing is, during pregnancy, anything can happen, things can change, and you may end up having a cesarean section or going through the normal delivery, which is vaginal delivery. In case you happen to undergo a cesarean section, once you are booked, if it's not an emergency, it means you'll be booked before you go into labor. That is with the cesarean section. So you don't wait until labor starts before you undergo a cesarean section, unless you are going through a vaginal delivery and the delivery is not progressing before you can be taken to the theater to have a cesarean section. Most of the times, if it is a planned cesarean section, maybe the baby is not lying well or there are placenta problems, you will be straight away booked for an elective cesarean section. So these are the procedures involved. Once your date is due, you'll be admitted onto the maternity ward. The maternity staff will counsel you, tell you the procedures involved, what you'll be experiencing, what you'll be expected to do, and all that. So, on the day of the procedure, that is on the day of your appointment for the cesarean section, you will be given a consent form to sign, and then your body will be prepared. That is, you'll be shaved down there. If the place is bushy, you'll be shaved, and then you will be prepped. Some people experience anxiety, fear, and all that when it's time for the procedure. So you'll be counseled to allay fears and anxiety. After then everything is done, you'll be ushered into the theater. So once you get to the theater, a theater staff will welcome you at the entrance and then usher you into the waiting room. That is, if it's a planned cesarean section, you'll be ushered into the waiting room where you'll be gowned, you'll be changed, you'll be given a hair net like this one to cover your hair. If you are wearing any earrings, any rings, any dentures, all those procedures will be done. It will be removed. If you are wearing beads, ideally it should be done at the ward, but sometimes workload and all that, it may come and you have those things on you. So we will make sure we take them out. You'll be given an IV line, a catheter will be inserted, that is to empty your bladder. Because if the bladder is full and we go inside and we are cutting, it may obstruct some of the process. So you'll be given a catheter to drain out your urine from the bladder, and then you'll be changed into a theater gown, or you'll be given a bed sheet to cover yourself, and then you'll be ushered into the theater. And once you enter into the theater, the anesthetist will take over from there. That is, he will explain procedure to you, how the anesthesia will go. You'll be given a numbing medication, which is anesthesia. It will numb you from the waist down. So meaning you will not feel any pain from here to your legs. There will be no pain. You'll be there, and then the procedure will be going on. We'll be chatting with you. You will be giving you all the support, and then the procedure will be going on, and you wouldn't feel anything. All you hear is maybe we talking, having conversations, and finally, if your baby is out, you hear the cry of your baby. So all this place, you wouldn't feel anything. You will feel as a Nancy Achiwu. Yes, that is how you feel. You wouldn't be able to even lift your leg. Yes. And the procedure will go on. You'll be cut open and the baby will be brought out. And then the placenta will be brought out and then you'll be sutured up. And then some dressings will be placed on the wound. And then you'll be moved out to the recovery where you'll be monitored for some time before you are finally taken to the maternity ward for further management. So that is it about cesarean section. You will not feel any pain, you will not feel any nothing. And you'll be given pain medications afterwards. So I think with the pain, there will be pain though after the procedure, but since you be on pain medication and all that, there wouldn't be much of a problem. Now let's go to vaginal delivery. With vaginal delivery, it is totally different. With that one, after you've successfully completed 37 weeks of pregnancy going, you can go into labor. You have to dilate to 10 centimeters before the head of your baby can pass through the birth canal, which is the down there. And that process is very painful. People who have undergone vaginal delivery will testify to that. It is very painful. I'm not disputing the fact that cesarean section is not painful. It is equally painful because you sebi your bed child nadi. But with that one, you'll be giving pain medication. You wouldn't feel the process. Afterwards, there will be pain, but you still be managed with painkillers, so you'll be able to, cope a little. But with vaginal delivery, you will feel every bit of pain from the contraction stage to the pushing stage until the baby comes out. And it is painful. Let nobody lie to you. It is very painful. Contraction pain is sometimes I can't find the words to describe the pain. It is so painful. It's like your let me say something is closed like that, and it has to open bit by bit by bit by bit, like the skin must stretch, the cervix must stretch open bit by bit. You cannot imagine the pain unless you experience it. So it will open gradually with some preemie women. That is, if it's your first time delivery, it takes time. Some may go for 12 hours, some more, some less than 12 hours. It's an individual thing. So you dilate till 10 cm, and then once you are 10 cm, you see that you are fully dilated, and now you can push your baby, and the baby will come out and it will be delivered successfully. The placenta will be brought out, the cord will be cut, and then your baby will be given to you. And you can initiate breastfeeding in some few hours. Yes, so that is basically cesarean section and vaginal delivery. Either ways are all good. Nobody choose to deliver either way. Sometimes pregnancy progressing may lead you to either cesarean section or vaginal delivery. So any way a woman brings out a child into the world, let us appreciate it, because we are all heroines, and that sacrifice alone, I don't even have the words to explain it. That sacrifice is out of the world. It's an experience that I wish every woman would go through, and then you tell the story for yourself and all that. So that is it. On this note, I want to wish every mother a happy Mother's Day. And then I want to tell you that your sacrifice is seen. You are seen, you are celebrated, you are appreciated. Even if you don't feel it, know that God sees all your toils, all your troubles, all your sacrifices, and God bless you. God bless us all. Have a lovely day. Bye.